Hey everyone, Dr. Tim with you here at Urgent Care Management Monthly with my beautiful wife Pam Reynolds, also our Chief Operating Officer and RN ER Nurse Deluxe. How are you?
Wow.
Mother of 5 beautiful children.
What an introduction.
Owner of 2 horses. What else? Scuba diver, underwater photographer. She has many talents.
I hope I know the answers to your
But
questions.
today, we're not going to talk about any of that.
Oh no.
Today we're going to talk about urgent care staffing models. So let me ask you a question. Why do we need a staffing model, and what is a staffing model?
You need a staffing model because it's important to know the plan going into it. It's the same thing as having a plan for everything else, the outline of how you run a clinic. You need to know what staff you need for busy times versus not busy times, Saturdays versus other days, and how many people you need in each department.
Okay, good. So if we're talking about that, that's kind of the trick of this game, right?
Yes.
It's kind of like emergency medicine or Applebee's, right?
Right.
Sometimes we're super busy, sometimes we're not as busy, and so how do you play that game? How do you play that?
Well, it's not completely a guessing game, but it is kind of tricky because you have parts of the day, typically in our urgent cares that we've seen trending over the last several months, that we see the same amount of patients from 8 o'clock in the morning until about 12:30 that we do see from 12:30 until close. And so you have the bulk of your staff in the morning, but you always have a rush in the afternoon. So you want to have a good set staff in the morning, make sure that you have adequate staffing, but you also want to make sure you have plenty of staffing to give great patient experiences later in the day.
So important thing is I think the key to what you just said is you track it over time.
Yes.
And based on what your tracking model shows, that's how you staff. Because just because that's true for us doesn't mean it's necessarily true in Maine or New York or California, right?
Exactly.
Okay, good. All right, so if somebody's opening up a new urgent care clinic and they've never staffed one before, what positions do you think are critical when they first start?
Well, when you open up, I think that one of the things that you definitely don't want to overlook is hiring a marketer. And you want to hire your marketer a couple months out, make a good decision on the marketing person, because you want your marketing up and running before you ever open. So that's going to be primarily what you're going to start out thinking about.
Whoa, stop the train.
Stop the train. Why are we stopping the train?
Are you telling me an urgent care should have a marketer?
I am telling you, your marketer is going to be the biggest functioning person for the first couple months before you open.
Is that because you were the marketer?
No, because I didn't know I was going to be the marketer, so no.
No, but I think this is an important point. We joke around, but the reality is we had to convince our partners that having a full-time marketer was a good idea. And I was convinced from the beginning that our success or failure would be how we marketed this thing. And I think a lot of people out there, this would come as a shock to them, because my guess is most urgent cares probably don't have a marketer. So
Sure.
Explain why that's important.
Well, I think that one of the points that you had made, I actually remember sitting around a table during the time you were convincing the other partners that we needed a marketer. I remember you saying something to the effect of, when was the last time you saw an ad for McDonald's? And they said, well, we saw one today. And they said, well, when did you see Nike advertise? And they said, well, we saw one probably today. And your point was, there are huge corporations that are well known worldwide, and they still market every day, because you still need to be in the forefront of people's minds every day. Urgent care is nothing different than that. You have patients who come in and become established patients, and then something else may pop up and they think they're going to go try the next best thing. You want to continually be in front of them, showing them why we're new, why we're different, what else we're doing.
What's fresh, what's new,
exactly.
What's exciting. Good. So you mentioned a marketer.
Yes.
So if someone's never hired a marketer before, which I bet most people have not, what are you looking for?
I think when a marketer walks in the door for their first interview, they should wow you, because that is how they're going to represent your company, in my mind.
They're marketing.
They're marketing themselves to you, and if they're not doing well at that, they're probably not going to market well for your company. The person who you'll be interviewing soon that came in for a marketing position with us, we were both wowed by her immediately. She was very organized. She had followed up to find out what the company was about before the interview even happened. That's huge. She took the time to learn what we were about and what we were selling and who we represented before she even came in for an interview. That was huge. They have to be outgoing. They have to be able to walk up to anybody on the street and tell what it is we do. And they have to be organized. Organization is huge.
Okay, good. All right, let's switch gears.
Okay.
You said a marketer, but you didn't tell me about the rest of the people we're going to staff with.
Well, obviously you should probably have some physicians.
All right, that's a good idea.
Which I actually want to turn that on you, since you're an owner.
You can't interview me.
I'm interviewing you now.
You can't interview me.
I can't.
All right.
So you're going to hire a physician. We're opening a new clinic. When are you going to hire a physician for that? Or are you just going to hire physicians?
Sooner versus later.
Okay.
And I mean that sincerely because there's a lot of things that have to happen. One, you want to get them on board with your philosophy and your ideas. Two, you want to get them credentialed and networked into the different insurance companies, Medicare, etc. So the sooner you can bring them on board, I would say even a couple months before you open the urgent care if possible, or at least start their credentialing process well ahead of the time you open the doors, the further ahead you'll be in your cash flow and money management as you go on. Now, it's easier said than done. Physicians are probably the most difficult thing to find, and they will either make or break your clinic, right? They present the patient experience. They are the person who the patient came to see, and so I think you need to find someone who is of your same philosophy, and that takes some work. We had some meetings today about that. Who do we want working for us, and how would we go find those people? So I think that's important.
So if you bring in a physician, when
You're
you
still
open
interviewing me.
when you open the doors, are you just bringing in a physician, or are you bringing physician extenders as well at that point?
You tell me.
My theory is bring physician extenders in as well.
What do you mean by extenders?
Extenders, nurse practitioners, and PAs.
Yeah.
Depending on, I'm assuming this is a state thing also. We are fortunate in the state of Texas where we can bring in, and Arkansas, where we can bring in nurse practitioners and physician's assistants to work in relationship with the physicians that we have on staff.
And in most states that's true. There are various laws that apply a little bit in each state. But yeah, I'm a big proponent of physician extenders, as you know. We have a lot of nurse practitioners and PAs, and they take good care of patients, I think, with correct supervision, and that's the key. Make sure they're supervised correctly, make sure they're doing what they were trained to do and not doing outside the purview of what they were trained to do, that they're staying within what they were supposed to do, they have correct supervision. I think they could be phenomenally successful. You could be successful with them, both from a business standpoint and a medical standpoint. So,
do you have any other questions for me?
yeah.
Okay.
So in addition to physicians, physician extenders, we're probably going to need a couple other people.
Yeah, we should hire some front desk people probably.
Reception, front desk,
your meet and greet folks. Typically when you open a clinic, the main thing you want to aim for is you don't want to overstaff, because you'll put yourself out of business before you ever bring any business in. It really depends on your hours that you're going to be open. Obviously, if you open for 8 hours a day, it's ideal staffing wise because you can hire one person through that shift.
Right.
Our clinics, we have tended to open more like 12 hours when we first opened, which you can bring in one front desk staff person to work those 12-hour shifts and hire 2 people. And so the front desk staff person we're talking about. The next person would be the nursing staff. Again, you don't want to overhire for this.
How many nurses do we hire?
We hire LVNs in our clinic. RNs.
Whoa.
I know.
You're an RN.
I know.
You're an RN and you're hiring LVNs.
I am.
What's up with that?
Because in our setting, there's nothing an LVN is not qualified to do. RNs tend to ask for a lot more money. LVNs do great in that role.
What's the disadvantage of LVNs?
Disadvantage of LVNs, within our setting, we don't have to give blood. We don't have to give a lot of those other things. So I don't really see a disadvantage in hiring LVNs. It's more of an experience. You want to hire LVNs who have some good experience.
Yeah.
If you're bringing them in to kind of run your clinic, you need somebody who has some good medical knowledge behind that.
Yeah.
And I think that's more important than an RN versus an LVN title.
I think our experience has been either you hire them straight out of training and you're willing to take the time to train them yourself, like our charge nurse John, or you hire somebody who has this type of experience. I think the difficulty with LVNs is most of them have never done acute care, and so they've either worked at a nursing home or home health agency or something like that, and we've had a really difficult time making a transition of that.
Right, because typically your LVNs from nursing homes don't start IVs.
Right.
They don't do a lot of IV medication administration. Right, and it's a quick moving setting. There are a lot of things they're not used to doing, but they're obviously trainable. So you're going to want to hire people who are energetic, people who are go-getters and who really want to learn for LVNs. After LVNs, then the next person you're going to look at is your X-ray person. Depending on what state you're in, again, you have to check out your state regulations, but some LVNs can actually do X-rays if they're put through a certification program. In our model right now, we're using X-ray. We have radiologists or X-ray techs there, but it is an option, and it definitely, if you're looking at a startup clinic, If you can hire an LVN who would do both x-rays and nursing, it's a much wiser decision because x-ray is also expensive.
If I get cross-trained someone to do my x-rays at this point, I think I would certainly in the beginning do that.
Yes.
We're busy enough now where an x-ray tech makes sense,
Right.
but in the beginning, I would recommend that.
And then the next thing that you're going to look at, really the next person you bring on after that is we call them patient care technicians, medical assistant. It doesn't need to be a certified person. It can be a person who comes in, it has the capability of drawing blood after you've trained them. They put the patients in the room, they do blood pressures and all kinds of things. The majority of our staff that comes in for that position is not trained beforehand. It's a pretty easy position to train for. Again, has the person who knows a lot.
And we have a training program.
And we have a training program. But we initially, when we open, we do not start with PCTs. We start with an x-ray person and a nurse.
Yeah, if you're seeing 10 patients a day, you don't need that.
Right.
Yeah, once you get up to a certain volume, then you start having to add other people in. And so kind of explain that a little bit. We weren't planning to talk about this, but how do you figure out when to add the next person, how to do that?
From the clinics that we have started, kind of the key turning point for us is if you have an x-ray and a nurse person there, they can easily see 3 patients an hour. 4 patients may be starting to push it a little bit because it depends on the acuity of the patients that you're seeing, obviously. But 3, if you have one of our clinics right now from 3:30 until they close at 8 o'clock, there's just an x-ray and a nurse there. They can very easily take care of it, but it's a little bit slower volume. I would certainly not put them on first thing in the morning together. So typically, once you get over about 3 patients an hour, you really need to add another person to that mix.
So we talked about cross-training. Who do you cross-train, who do you not cross-train?
Our PCTs and x-ray, obviously x-ray, they're the only ones that get to do x-ray techs, are the only ones that get to do x-rays in our facility, but we also train them to be patient care technicians. So they pick up patients, they do vital signs, they do EKGs, they draw blood, they can run the lab, they can do everything everyone else can do. But we also have gone a step further to say, okay, now we've learned how to do that. On days that we're a little bit slower, we take them to the front desk and teach them how to check in a patient. Because if you've got, as a new clinic, if you've got one person working in the front desk and they're checking in people, it's really nice if somebody else can step up there and be able to check somebody out.
Or do a drug screen.
Or do a drug screen.
Or
do vital signs or anything else. So we really encourage all of our staff to cross-train into at least one more area than what they're in currently.
And so then how do you track that? How do you say, yes, our staffing is correct, no, it's not correct? How do you track that?
We just guess. Okay. I'm just kidding. We trend it. We actually I'm constantly looking at reports saying how many patients are we seeing an hour. And all of the clinics, we know right now how many patients we're averaging in an hour in each place. I know how many staff members are each one. I also track how many patients are being picked up by each one of those PCTs per hour. So I can see if we have a strong PCT versus a PCT who may not be doing as much work. I don't expect the x-ray staff to pick up as many patients because they're also doing x-rays in addition to that. So I trend to see at position what their productivity is. And then I compare that with how many patients we're seeing an hour for each place. And then we also look at how quickly we're moving staff, how quickly we're moving patients in and out of the building. How long are they waiting to be picked up at the front desk to be put in, or from the waiting room to be put into your room?
It's kind of scientific.
It's very scientific.
And then we also track the same thing for the physicians and the physician extenders, how many patients an hour, etc. How much time the patient spends in the room. The other way you can do that is financially. You can track dollars per hour for each position. How many dollars is the clinic bringing in per position, and then you can figure it out in a formula way, and we'll probably put that on our website actually so people can see what that looks like.
There's one more position too we didn't talk about.
What's
an
that?
Office manager.
Yeah.
It really depends on who's opening the clinic because we have met at urgent care conferences. We've met, the husband's a doctor and his wife comes in as an office manager, or it may be a PA who's
or the wife's the doctor.
Or the wife is the doctor and the husband is the office manager. Because a lot of times it's family started, and so one of the spouses will take over as an office manager. There are other ones where they come in and hire an office manager. The question is, when do you hire an office manager? Is there some roles that you can give, some dual roles that you can give staff so that you don't have to hire an office manager? You really have to play if it's a position you want to hire for to begin with or not, because it does add a whole other salary. I think that if it gets to the point where, like we were talking about, you're seeing 3 to 4 patients an hour, you're going to have to start realizing that there are other roles here that, they're there to see the patients, and there's not a whole lot of crossing between office managerial stuff. But I think that one of the positions as marketing we talked about before is that there's a few little things I can do to help out, and a few little things other people can do to help out. that you can maybe hold off a little bit to hire a full-time office manager if you need to.
What would you look for in an office manager?
Office manager position really needs to be somebody who is good at leading themselves. They need to be somebody who is willing to jump in and do what needs to be done. They're learning all these roles. They can step up and help at the front desk. They can help with marketing. They are somebody who does not need to be told what to do next. They're a person who jumps in and says, what else can I do here? What else can I learn here? And really be organized and really have a lot of energy for the group to be there to
I think they need to be a good leader of people, and I also think more now than I used to that they need to have a good business sense. So
Yes.
they need to understand financials of a clinic. They need to understand how things work in that background.
Yes,
Good.
I agree.
Anything else you'd like to add?
I don't know. Did we answer all of our questions we
Answered all
talked
the
about?
questions.
We answered all of them?
Yep.
I think that's all I have to talk about.
All right. Thank you for coming.
Thank you for your time.
Bye.
Bye.